Arizona working to slow the spread as the number of cases goes up.
Katie, the total now surpassing 400 in Arizona, including the first cases in La Paz County. Health officials also reporting a 7th death. In fact, here's a county-by-county case map. Health officials acknowledging we have yet to hit the peak in our state.
ABC 15's Zach Crenshaw kicking off our team coverage tonight, looking at how our healthcare system is trying to prepare.
Arizona health experts say our state has some time to prepare, projecting peak hospitalizations in early May. And while New York City and Seattle are scrambling right now to find more ventilators and space, Arizona is activating its emergency plan and preparing to double the number of hospital and ICU beds. Last Wednesday, Arizona had 30 coronavirus cases. Now, more than 13 times that. The number expected to rise as exponentially next week, and the week after, and the week after.
The peak of our illnesses will start mid to end of April.
Dr. Kara Christ says based on some, quote, worst case projections, Arizona could need 16,000 more hospital beds and 1,500 more ICU beds, more than double what's currently available.
We expect it to be above and beyond our current capacity of beds.
We have too little resources to address it.
ASU professor James Hodge is a health crisis expert, and he contributed to the state's Crisis Standards of Care plan, which was activated Wednesday.
We trained for it as well. This is not a plan that sat dusty on shelves.
Essentially, the state is telling hospitals, gear up and get ready for battle.
The test is about to begin.
Hospitals now preparing for tents, hotlines, staffing, and supply shortages. But Professor Hodge says we have the benefit of learning from those cities currently fighting the outbreak.
We have a chance to actually do things differently in other states.
On the economy side of things, Governor Ducey announcing new initiatives to help families, like expanding food assistance programs and increasing telemedicine.
And then at the appropriate time, we can talk about what's next. But this focus on public health and economic relief.
While the economic impact has consumed D.C., Arizona focused squarely on COVID-19 because while it's invisible, it's spreading as we speak. Soon, it'll consume all the hospital beds in the state and the ones we don't yet have.
But that's what we are trying to get ahead of.
State leaders also announcing today they've requested almost all of Arizona's share of the strategic national medical stockpile, meaning our state has tens of thousands of gloves, face shields, masks, and hospital gowns on their way to be distributed to hospitals before that peak period in May. To many, though, they can't come soon enough. In Phoenix tonight, Zach Crenshaw, ABC 15, Arizona.